lunchtime. So my name is Stephanie Simmons. I am a child psychologist here at UT Health. I have been with the hospital for about years and serve both in the outpatient clinic seeing children and adolescents. And I am also the director of our psychology internship training program. Before coming to UT Health, I completed my doctorate in clinical psychology at Baylor University, and then completed my internship in community mental health in Cincinnati, Ohio, before returning to Texas to do my fellowship in pediatric psychology at Texas Scottish Rite Hospital. So I've been bouncing around the state of Texas for the last almost 10 years and worked with a lot of kids in a lot of different contexts. And so what we are going to be talking about today is a problem that I'm sure all of you have experienced at some point in time, whether it be in your practice, with your own children, or even with yourself. So we are going to be talking about school refusal behavior, kind of what that looks like, what that entails, and what to do about it. So our learning objectives today, we are going to talk about just the spectrum of what school refusal behavior can look like, and kind of why that comes to be. We're going to talk about really how a multi-tier model for problematic school absenteeism looks like, and kind of how different interventions at different tiers can look. We are going to talk about treatment options, specifically behavioral interventions, and then briefly discuss some methods to collaborate with schools to support healthy return to school behaviors. So as we know, school attendance is a key expectation for children and adolescents. Kids have to go to school in one way, shape, or form. We also know that attending school has a lot of really positive outcomes for kids. So youth who complete high school are more likely to experience greater social, academic, occupational, and economical success in their lifetime compared to youth who do not complete high school. Conversely, youth who have problematic school absenteeism are at risk for lower academic performance, fewer literacy skills, internalizing and externalizing behaviors, being retained in their previous grade, being involved in the juvenile justice system, and eventually dropping out and not completing high school. We also know that school refusal behavior is common. I'm sure we can all remember days growing up when we protested getting up, getting out of bed, not wanting to go to school. So this is something that is fairly common in the population. Approximately a third of American school-aged youth may have some sort of school refusal behavior that goes over 2 weeks, and up to 13% struggle with chronic absenteeism. So that's a pretty significant minority. And I'm sure for those of you who have worked with these kids, we know that it can be very complicated and very distressing in a lot of different ways. School refusal behavior is equally seen in boys and girls and across families of various socioeconomic statuses. We do know that school dropout rate tends to be higher among Hispanic youth. Most children with school refusal behaviors are around 10 to 13 years old. So those prime middle school ages where nobody really wants to go to school. But we also see peaks around 5 to 6 years old when a child first enters school, and then around 14 to 15 as students are transitioning into high school. So we're really kind of looking at those transitional periods as our most problematic times. School absenteeism has historically been defined in a lot of different ways, including truancy, school refusal, school absenteeism. However, those terms really don't represent all youth who have trouble attending school. So throughout this presentation, we're going to be using the term school refusal behavior as really an umbrella term that defines an inability to maintain age-appropriate functioning of school attendance, or the lack of the ability to adaptively cope with school-related stressors that can contribute to non-attendance. So when we're looking at school refusal behaviors, this can look a lot of different ways, and it's really on quite a spectrum. So we can range all the way from students who are completely absent from school for short or long periods of time. We can be looking at kids who may attend part of school but leave during the day. They may skip classes, call mom, try to go home after lunch, or to avoid certain classes. We may have kids with chronic tardiness who are just consistently late to school. Maybe some kids who get dragged to school after intense morning misbehavior, so throwing tantrums, having meltdowns. And we can also just have kids who have substantial distress during the school days. So they might be attending regularly, but experiencing a lot of anxiety and a lot of discomfort leading up to getting to school. And that may contribute to a lot of pleading to stay home, and continuing to want to avoid school. So as I mentioned, this is really a spectrum of behaviors. And it's important for us to really understand where a child is falling on this spectrum. A lot of parents may say, well, my child doesn't want to go to school. That can mean a lot of different things. So again, we really want to understand, does this mean your child just doesn't want to go because they don't want to get up, but once they're up and moving, they're really fine? Or is this, your child is having such extreme distress that they have not been attending school for over 2 weeks? I also want to point out that it's fairly common for children to have difficulty attending school at the beginning of the year or upon transitioning to a new school. Many of these behaviors are self-corrected and naturally remit spontaneously within 2 weeks as the child acclimates to school, or as parents get more effective in enforcing attendance. So a lot of times, when families come in saying that their child is refusing school and saying that the problem just started, we can often give them 2 weeks to really just see if the behaviors will naturally remit and naturally take care of themselves. Um, Another thing to point out with this spectrum of behaviors is that we often don't see youth fitting nicely into one of these boxes. And many students show fluctuating behaviors. So, for example, they may skip school completely on Monday, come late on Tuesday, attend Wednesday morning, but not in the afternoon, and then come to school Thursday and Friday, but experience a lot of distress. So kind of the hallmark of school refusal behavior is heterogeneity, because there's a lot of different presenting behaviors that are typical in this population. So as we are thinking about assessing problematic school behavior, again, we need to understand a lot more than just my child doesn't want to go to school. So we really want to define what the problem behavior is. So as we talked about, school refusal is really a multifaceted construct that includes a variety of behaviors, and we need to understand what exactly the behavior entails. Is it completely skipping? Is it attending but having a lot of distress, having tantrums in the morning? Is the parent allowing the child to stay at home? We really want to get out, what does this look like? This may include asking parents to log their child's behavior over a period of time. This can also involve like collaborating with the schools and actually calling to get the attendance records, since what parents and children are reporting does not always line up with actually what the school has down on paper. Again, this is important because types of absences can also vary. What a parent thinks of as an excused absence may not actually count as excused by the school. We also want to understand the development of the school behavior. So is this something that has always been difficult? Has it always been challenging to get your child to go to school? Or did this start following a specific event? So that might be the start of the school year. That might be experiencing bullying, having difficulty in a class. And really understanding those other factors are going to help us flesh out the problem and flesh out our interventions. Finally, we want to talk about and think about other contextual factors that may contribute to school refusal behaviors. So this may include things like learning problems. If a child is having a lot of trouble keeping up in class, chances are they're probably not going to be super keen to attend that class. We also want to think about poor parental supervision. So if parents aren't actually watching their child get on the bus, if they're not really paying attention to if their child is skipping and coming home during the day, it's really hard to enforce school attendance. Family factors may include things like homelessness, low socioeconomic status, transportation issues, and then school factors such as bullying or spending time with deviant peers may all go into kind of what is this problem behavior. Secondly, we want to pinpoint the variables that maintain the school refusal behavior. So in essence, what is the major function of school refusal for the child? And we'll talk about this more in depth, but we're typically looking at four major reasons why a child may be skipping school or refusing to attend school. So we want to know, does the child refuse school because they're generally distressed or upset about school? Because they want to escape social and or evaluative situations, because they want to get attention from the caregiver, or because they want some tangible reward outside of schools. And those tangible rewards may include things like spending time with friends, playing video games, sleeping, using substances, anything like that. So again, we really want to understand what function is the school refusal behavior serving for the child. And then the final question we want to think about is, what is the best treatment for school refusal behavior? And the best treatment really depends largely on the function of the school refusal behavior. So some potential questions that we might want to be asking families, is your child's refusal to attend school legitimate or understandable in some way? If a child has recently started being bullied at school, that's really important for us to know, because that is going to change the way that we intervene with this family and the way that we suggest the family collaborate with the school. We want to understand what the child's academic status is and what work they might be required to make up. This is kind of a vicious cycle, because a lot of times, the longer the child is out of school, the more difficult it is to catch up, and the more distress that may be causing them. And so we kind of want to understand, where in this process are they, and is it even feasible for this child to catch up? We also want to be asking what they're currently doing with the schools. It's sometimes a little shocking how many parents will come to medical providers and behavioral health providers about school refusal behaviors before they ever are collaborating or talking with the school. And so it's really important to encourage parents to be working and talking closely with school officials, to be discussing options that might be in place to help their child attend school. We will talk more about Section 504 plans and individualized education plans towards the end of the presentation. We also wanted to know about school policies regarding absenteeism, and like I said, I'll also touch on truancy behaviors later in the presentation. If behaviors have gotten extremely advanced, we may be thinking about alternative education programs that the child may be eligible for, as well as cultural variables that may be impacting a child's school refusal behaviors. So when we're thinking about interventions for school refusal behaviors and really what to do with them, we can take a multi-tiered approach. Before we jump into this, I want to quickly define acute school refusal versus chronic school refusal, because the differentiation between those two will really help us decide where a child is falling on this model. So acute school refusal is any school refusal behavior that lasts between 2 weeks to 1 calendar year. We contrast that with chronic school refusal, and that's cases that are lasting more than 1 calendar year and therefore stretching across at least 2 academic years. So interventions for school refusal behavior can be arranged on kind of what we see here, this multi-tiered approach. So tier 1 approaches are typically school or district-wide strategies designed to prevent school absenteeism and decrease dropout rates. So these may include things that are done at school, like starting a mentoring program to help students feel connected, monitoring attendance and following up with the 25% of students with the poorest attendance, creating extracurricular opportunities to help students feel involved, using alternative disciplinary strategies to suspension, or addressing barriers to attendance such as lack of food, appropriate clothing, etc. Ideally, these interventions on the tier 1 level will benefit all students and will encourage attendance and involvement across the board. Tier 2 approaches are early intervention strategies targeting towards those emerging and acute school attendance problems. So like we said, students who have been absent between 2 weeks to 1 calendar year, or those students who regularly attend school but with significant distress. Tier 2 behaviors are extremely responsive to behavioral interventions with the goal of returning the child to school successfully. And where we're going to focus today is primarily our Tier 2 interventions. Tier 3 approaches strive to address those chronic school refusals. So children who have been refusing school between for more than one calendar year. And so this is really our severe and complex attendance problems. Interventions in this tier may include things like alternative education programs. So whether attending online, being homeschooled, specialized program, or even intensive residential day schools. So some parents may consider transferring their children to smaller charter schools, homeschooling, online schooling, etc. Other parents may consider allowing their child to drop out of school and complete a GED program. So again, these are not our first kind of go-to approaches, but really things that we want to consider once the behavior has gotten extremely severe and extremely complex, and that there's a good chance that that child may not realistically be able to catch up academically in their current setting. So as I mentioned, when we're thinking about treatment planning, it's really important for us to understand the function of the school refusal behavior. And as I mentioned, we are typically looking at 4 primary functions that can often overlap. So the first primary function or primary reason that children may refuse school is to avoid any school-related stimuli that may provoke negative emotions. So these may be feelings of depression, feelings of anxiety. So some specific presentations that we see in this category may include learning problems that are causing distress, separation anxiety, anything along those lines. It may also include more straightforward depression if a student is lacking the motivation or the drive to actually get up and attend school. The second function that we may consider is that children refuse school to escape aversive social and evaluative situations. So these are really our social anxiety kids. So our kids who are nervous about how they may be perceived by others, how they may interact with others, how others may interact with them, as well as how they might be evaluated by other people, peers and teachers. So they may be very nervous about speaking in front of the class, taking tests, getting grades back, anything like that. And so school refusal may serve the function to avoid that anxiety and avoid those anxiety-provoking situations. The third reason that children may refuse school is for attention. And this is primarily from caregivers and may look like having significant tantrums, meltdowns, or other behaviors to avoid school. And then as discussed, children may often refuse school for tangible rewards outside of school. So this may be hanging out with friends, playing video games instead of going to school, sleeping, using substances, anything like that. As I mentioned, it's also possible for a child to be having multiple reasons why they are not attending school. So for example, a child may present with a lot of stomach aches and meltdowns related to social anxiety. So they may both be engaging in behaviors to get their parents' attention, as well as using those behaviors as a way to avoid social situations. So again, this is really important to think about and to really ask about why a child is avoiding school and what might happen and what might feel uncomfortable if they do attend school. All right, so moving into treatment options. Before I discuss this, I want to be very clear that I am not a psychiatrist. I do not prescribe medication. And so the information from this slide, I directly pulled from the article that I have highlighted on the bottom. And so this was just a systematic meta-analysis of studies that looked at pharmacological treatments for school refusal behavior. And I will also caveat this with there is a huge lack of current pharmacological studies available to guide clinical decision making. Very, very few studies have rigorously studied the use of pharmacotherapy in school refusal, and even fewer studies have examined the efficacy of commonly used antidepressant agents. The trials that do exist are severely underpowered and really detect small to medium expected treatment benefits of any medication. So with the medication slide, please take it with a grain of salt because there is not a lot of information out there informing how medications can specifically contribute to school refusal behavior. But I do want to briefly touch on the few studies that do exist. So a couple of studies have been done looking at SSRI, specifically fluoxetine. So one study in China, children were assigned to CBT treatment only or fluoxetine plus CBT. And both groups had a significantly improved return to school, but there was really no difference between just therapy and therapy combined with medication. Another study found something similar where they combined therapy and fluoxetine, therapy and a placebo, and therapy alone. All groups saw improvement, but there was no significant difference between the groups. Other studies have looked at tricyclic antidepressants, but again, only 5 studies total have actually looked at this in regards to school refusal behavior. So some studies show that there have been significant improvement in anxiety and depression, but really overall what we're finding is that there's no significant differences between individual therapy alone compared to individual therapy combined with medication. Similarly with benzodiazepines, only one study has been done, and there was no significant difference between therapy alone versus therapy plus medication. So when thinking about medication, we want to think about things that might be contributing to and might be helpful with a child's anxiety, but really remembering that our behavioral treatments are going to be our first line of defense with this specific population. If you have further questions about medication, I highly suggest consulting our CPN psychiatrist, as I'm sure they will be able to talk about this in a good bit more depth. So now we'll jump to the things that I do feel a little bit more confident talking about and have had some more experience with. So as I mentioned, we're going to take a slightly different approach depending on what the function of the school refusal behavior is. So thinking first about children who refuse school to avoid negative affectivity. So again, these may be kids with trouble learning, separation anxiety, loneliness, depression, bullying, etc. Our main goal in treatment is to change avoidance behavior, to build coping, and to build active school attendance. So kind of where we start is really helping a child understand the connection between their physical sensations, their thoughts, their behaviors. So really just some good classic CBT. We're also going to work with parents and work with children to understand how anxiety is maintained over time. We will also work with kids to build an anxiety hierarchy and really think through kind of what are the things that make them uncomfortable about returning to school. And then we are going to work on actually exposing them to those uncomfortable situations in a step-by-step fashion so that we can learn to successfully and adaptively cope with things that cause them distress. With this, we are also going to be gradually reintegrating the student into school by collaborating closely with parents and the school system to address those negative behaviors. And so this is really done in a stepwise fashion so that children are learning to adaptively manage situations that make them feel uncomfortable and getting to a point where they can fully return to school. So as I mentioned, we have to spend a good bit of time educating not only children, but also parents about how avoidance plays into this cycle. So I spend a lot of time using this specific graph to kind of talk about the role of avoidance. So a lot of times when we and children experience anxiety, our go-to is to avoid whatever that thing is. So, for example, if we are really scared of spiders, we probably aren't going to spend a lot of time like picking up spiders or keeping spiders as pets. We're probably going to stay pretty far away from them. And in a lot of situations, that can be adaptive. But when we put this in the context of school refusal behavior, if attending school is the thing that's causing anxiety, avoiding school is really not an adaptive response to that. Children have to attend school. And so while avoiding school may cause short-term relief from the anxiety, over time, it's going to cause that anxiety to grow. So like we mentioned, the longer that a child is out of school, the more work is going to be piled up and the scarier that their return is going to seem. The important part for parents to understand is that we have to break the cycle between anxiety and avoidance, and parents are really crucial to that. Unfortunately, parents often have a hard time watching their child struggle, especially when they're experiencing pretty intense emotions. And so parents will often kind of inadvertently offer that short-term relief by allowing the child to stay home. So that allows the child to not only avoid school, but also allows them that short-term relief from their difficult emotions and allows parents to feel a lot better because their child is not having a difficult time. So where parents are so important is that parents have to be able to tolerate their child's short-term anxiety and distress in order to get them to return to school. So this often involves really developing a very specific coping plan with parents to decrease the chances that they're going to give in and continue this cycle of avoidance. I also wanted to just kind of show what a sample hierarchy might look like. This is specifically for separation anxiety and school refusal. But just kind of thinking about what some of our activities in therapy might look like. So at the very beginning of therapy, we may be starting with something that doesn't feel super distressing. So the SUDs are subjective units of distress. And so we'll see that something like mom leaving the therapy room for half of the session and waiting in the waiting room, it's not really something that's going to cause significant distress. But as we move up our hierarchy, we may see that going to school, not contacting mom, those are things that are going to cause more and more distress. So in therapy, what we are working on and what we are working on behaviorally is learning to deal adaptively with the situations that cause lower levels of distress so that we can slowly move up and enable a child to reach their eventual goal of attending school the entire day with no contact from mom. Throughout this, we're going to be working on psychoeducation as well as learning somatic relaxation to manage those somatic complaints that come up. Our treatment for children who refuse school for social anxiety is going to look fairly similar, but isn't going to involve the goal of really working on how changing the way that a child interprets social situations. So many children, especially adolescents, assume that everyone is paying very close attention to them and maybe pretty harshly judging kind of any simple mistake that they might make. These kids may spend a lot of time ruminating and replaying social interactions that they have and having a lot of fear over how others are evaluating them. So our main goal when we are working on behavioral interventions, this specific population, is to help children identify what they tell themselves and to work on changing those negative thoughts to more helpful cognitions. So for example, if a child is saying, I sound so stupid anytime I go up and introduce myself and people are judging me, we may work on changing those negative thoughts to something more helpful, such as, not everyone is going to judge me. Maybe people will judge me favorably. Similarly to what I was talking about previously, we will also be working on graduated exposure to anxiety-provoking social situations so that we can gradually increase school attendance. And we're going to work on practicing both the exposure activities, as well as coping skills in real life situations so that kids can get really good at using them. So again, this is another sample fear hierarchy, more specifically related to the fear of giving a final presentation in class. So we may start with just identifying topics and moving up to video recording, practicing with family, practicing with friends, and eventually practicing in class. These hierarchies can also, as I mentioned, look like a gradual return to school. So if a child is having significant trouble attending school for an entire day, we may start with something like just walking to the front door and being inside the building for 10 minutes. And then we may increase that to attending your first two classes, attending until lunch, attending 3/4 of the day, and eventually attending for the entire day. The important takeaway from this is that a lot of times kids will need this scaffolding in order to support their return to school rather than just kind of ripping the Band-Aid off and doing it cold turkey. On the flip side, when we are working with children who are refusing school for attention, we are mostly going to be using key elements of contingency management. Most of our time will be spent working with parents, but we want kids to be involved so they know what's happening. So we're going to be working with parents to help them be giving effective commands so that they can really give effective commands to get their child up, get them ready, and get them out the door to school. We want to help parents establish a routine, specifically getting up and getting ready for school. And this also involves helping parents improve how they're responding to their child's behavior in the morning. It's really maladaptive and pretty unhelpful for parents and kids to be getting in these huge arguments every single morning about attending school. And we really want parents to be ignoring as much of the school refusal behavior as possible. So ignoring crying, tantrums, physical complaints, etc. This is very different because many parents are accustomed to attending to their children only when they're misbehaving. So we really need to help parents practice shifting attention away from the negative behaviors and more towards the positive behaviors. Finally, we're going to be helping parents establish a system to reward school attendance and discipline school refusal. So there should be clear, consistent consequences implemented each time a child refuses school. Additionally, children can be able to earn rewards for attending school. We really want to lean more towards privileges rather than monetary or physical items, as that's often not sustainable for parents. So, for example, if we are thinking about setting up consequences and rewards, the consequence for not attending school on any given day may be that the child is grounded for 2 days. If they are able to attend school, they may earn a privilege like extra time before bed, increased screen time, getting dessert after dinner, anything that works for the child. Alternatively, we could also let children earn incremental rewards. So, for example, an adolescent could earn 30 minutes of screen time for each class they attend during the day. Again, parents are hugely important in this as they must be prepared to enforce consequences. If a parent gives in to school refusal behavior, children very quickly learn that, okay, this is how I get out of the thing that I don't want to do. We also need parents to be aware that behaviors often increase before they decrease. So if a child has been used to crying and tantruming to avoid school, there's a pretty good chance that those tantrums and that crying is going to escalate to the point of the extinction burst when the child actually learns, okay, mom and dad aren't giving in to me. This isn't a helpful behavior anymore. Finally, behavioral interventions for students who are looking for those tangible rewards outside of school looks a little different. So this presentation is most often seen in adolescents. And so our goals are really to increase communication and effective problem solving with the entire family. If we only focus on the parents, that can be problematic as adolescents may become more defiant if they're not involved in adaptive decision making. So some potential interventions may include helping families learn better ways of solving problems and reducing conflict. So, for example, this may include finding ways and places to negotiate problem situations. At the beginning, this often takes place in the therapy session, but we want families to be understanding and getting in the habit of holding family meetings to discuss problem behaviors at appropriate times. We also want parents to learn to define problem behaviors in a very clearly defined way. So, for example, a parent may say that the problem is my child never takes out the trash when I ask. The adolescent may say, the problem is I always have to take out the trash. Both of these are related to the core problem that the trash is not getting taken out. And so if we focus on that problem, that kind of gets us both on the same page, gets us to a place where we can actually negotiate a potential solution. Contracting for school attendance is also an important intervention in this population. So contracting is really just kind of a fancy way of coming to an agreement of what the child is expected to do and what will happen if they do or do not attend school. So kind of similarly, maybe the adolescent earns extra privileges if they do attend school, and they lose privileges if they elect to not attend school. Therapists will also help adolescents learn things like peer refusal skills, sleep hygiene skills, and other coping skills that may enable them to better fulfill their contracted behaviors. So that was a very quick and dirty kind of rundown of behavioral interventions. Please feel free to drop questions in the chat, and we'll also have time for questions at the end. When we are thinking about collaborating with schools, there are two kind of major things that we want to consider. First is truancy laws. So whether we like it or not, truancy laws exist. Texas law requires students ages 6 to 19 to attend school each day that instruction is provided. This rule also applies to children under 6 who are voluntarily enrolled in pre-kindergarten or kindergarten. There are exceptions made for students who are pregnant, in foster care, homeless, or the principal earners for their families. Excused absences may also include medical appointments or other legitimate reasons to miss school. In Texas, we have a 90% rule. So students are considered truant if they miss more than 10% of instructional days. This may include parts of days as well. So if a student is constantly missing first period, but attending the rest of their classes, they can still be considered truant because they are consistently missing that one class. Parents may be subject to prosecution in truancy court if children are not abiding by that 90% rule. So parents may be required to participate in counseling, take classes, etc. And if they're found in contempt, they may face fines or even jail time. Students will not be criminally charged for truancy, but can participate in truancy court. So truancy court may involve requiring that a child attend school regularly, adding on required tutorials, performing community service, attending counseling, or receiving job training skills. Truancy court also has the ability to suspend a driver's license or a driver's permit. So ideally, we want to be preventing parents and children from getting to truancy court. But anytime I'm working with a school refusal case, I really encourage parents to research and talk with school officials about their truancy, the truancy expectations at their individual school, as well as understanding where their child already is in that process. A lot of times parents aren't aware of how many days their child has missed. And so again, kind of getting those actual records and working with the school is very key in this population. As providers, we may be asked to provide documentation of mental health disorders that contribute to school avoidance. And we can provide that documentation, but we can also advocate for certain accommodations. This is something that mental health providers do a lot. So I would highly encourage families to work with a mental health provider because there's a lot of ongoing communication that happens between providers in the school, and this can get really time consuming, especially with difficult to manage children. So the more people that can be on this family's team and working for this family, the better. When we are thinking about accommodations, we may be thinking about a Section 504 plan or an individualized education plan. Diagnoses such as depression, anxiety, ADHD, those are all things that can entitle a student to a Section 504 plan. The major difference between these two interventions is that a Section 504 plan does not change the actual curriculum, only provides accommodations that help a student keep up with the regular curriculum. An individualized education plan may be more appropriate for more advanced cases, as with an IEP, the school can actually alter the curriculum. So they may be able to decrease the amount of schoolwork that a child has to do, change testing requirements, things like that. So one of the major accommodations that we can think about is gradual reentry to school and creating a gradual reentry plan. So again, we think about our hierarchy and thinking about increasing the time or the length of time that a student is spending at school. And so we want to come up with a very detailed plan of how this is going to look and how long it's going to take. So obviously we don't want this to take an entire school year because that's not really beneficial to the family. So we're going to be moving it fairly quickly and at a pace that a child is able to keep up with. So like I mentioned earlier, gradual reentry may look like attending half days for a period of time, leaving after lunch, or attending a certain percentage of the day. The important thing to keep in mind here is that we are going to be increasing that amount of time in conjunction with the school. We can also work on reducing stress at key times of the day. So there are often very specific times during the day when a student experiences the most distress. Typical times may be first entering the school, going to challenging classes, walking through crowded hallways, or just general transitions. Potential accommodations that can reduce stress at key times may include things like being greeted at the front door in the morning by a trusted adult and being escorted to class, being allowed to start school a little later to avoid the initial rush, leaving classes a little early to get through the hallways. And like I said, beginning the day with a trusted staff member in a safe place. Potential coping skills that we may want to accommodate for are things like providing a safe path to leave the classroom for a short period of time to regroup or utilize counseling or coping skills. This may be going to briefly talk to the school counselor, to the school nurse, or even stepping out in the hallway to take some deep breaths and kind of regroup before returning to class. We also may be able to accommodate for coping tools in the classroom. So for example, paper to doodle on, fidget toys, headphones that may be used during free time, drinking water, anything that helps keep that child grounded and feeling comfortable can be accommodated in the classroom. Finally, we may also be able to modify coursework. So we may be able to think about breaking down larger assignments, validating effort rather than grades, allowing extra time to complete assignments, testing in a separate room, presenting only to teachers, etc. This is especially important as students are catching up on work after a period of non-attendance. It's often extremely difficult for students to complete all of the work that they missed. And so it's important for the families to work with the schools to determine an academic catch-up plan that is feasible for the students. I also want to point out that these accommodations should only be short-term solutions, as the goal is for the students to fully reintegrate into school without accommodations. We also want to be careful to minimize accommodations that encourage avoidance behaviors. For example, if a child is allowed to leave class to regroup for an undetermined amount of time, that may allow them to avoid classes that feel extremely difficult to them. However, if we're being very specific that they can step into the hallway for 5 minutes to use some of their coping skills and then re-enter the classroom, that does not encourage the same amount of avoidance. So again, we're thinking about these as short-term solutions and thinking about reducing that avoidance. So major takeaways when we are thinking about school refusal behavior. Many children experience school refusal behavior, and those school refusal behaviors can look a lot of different ways. Determining the function of the school behavior is key to selecting appropriate treatment, and early interventions are the most likely to enable healthy return to school. Behavioral accommodations and interventions are really our first line of defense. Given that medication is not thoroughly researched in this specific presentation, medications may be used to manage symptoms in conjunction with behavioral treatment. And then finally, collaboration with the school, and I would encourage with mental health providers, is vitally important to just give the child the structured plan that they need to actually return to school and to support the family in an adaptive way that actually gets the child back. Hi, so I think we have about 10 minutes. Oh, an example of I'll take questions. So an example of a contract, I don't have one right in front of me, but I would be happy to add it onto the slide deck. So a sample of a contract might be something like the expected behavior is that the child attends school every day. And so that's the contracted behavior. We would also then have a contracted consequence. So if the child does not attend school, they will be grounded and will not be allowed to go out with friends for 2 days. We would then also have a contracted reward. So if the child does go to school, they may earn the privilege to use the car over the weekend, something like that. So again, I'm happy to kind of include a sample or a format for a contract, but it's really going to be very specific to each individual child and each individual family. Good question, though. Other questions that I can answer? I know that was a very quick rundown. Would you expand what you mean by function? Oh, determining the function of school behavior is key. Yes. So as I mentioned, there's those 4 primary reasons that children avoid school. So it may be to avoid negative emotions, to avoid social situations, to get attention, or to engage in some sort of behavior that's more rewarding outside of school. And so if we just approach all school refusal cases exactly the same way, we're less likely to be successful because we are not specifically addressing why the student is refusing school. So we need to first start by determining why the student is refusing school so that we can then select the most appropriate intervention. Other questions? Or hopefully that helps. Hopefully that helps answer that question. So Meredith has put up the CE code. So if you can go ahead, there's also the links to the forms. So Dr. Mundo, would you allow a child to withdraw from a subject that is causing the stress or push through with it, maybe design a different curriculum? So again, this is largely going to depend on the individual child as well as the subject that's causing significant stress. So let's say, for example, a child is having a really hard time in Spanish, but switching to a different foreign language, such as sign language or French, it alleviates the anxiety. that might be perfectly acceptable. The problem is if, let's say, that math, which is a required subject, if that's the subject that is um, causing stress, that's not something that we can just allow them to withdraw from. So we would, if it is a required subject, we would typically be looking at helping them learn to cope with the stress. However, we also would want to be considering, are there legitimate learning disabilities or learning problems, in which case a different curriculum may be really helpful. So for example, if a child has dyslexia, they're probably not going to be required to keep up in English exactly the same way as a normally developing child would. So again, it's very multifaceted, and I think again goes back to why it's so important to understand what factors are playing into the avoidance behavior. Does that help? Hopefully. Any other questions? I will, thanks, Dr. Munda. I will plan to stay on for a few minutes if anyone has any questions. If not, I really appreciate everyone being here today, and hopefully that gave you kind of a place to start with these school refusal cases, as I know they can be extremely challenging and extremely difficult to deal with. As I said, please refer. We are more than happy, behavioral health is more than happy to help, since I know that these can also be very time consuming cases. Great. Thank you all for being here. I hope you enjoy the rest of your afternoons and that your weeks get off to a good start.
Thank you, everyone. And for anyone who is with T-Chat, please click on the forms. That would be the best way to receive a CE from the T-Chat program. Thank you, everyone. Have a great week.
Thanks, Jay.